Okay, this lecture is on central auditory processing disorders. We're going to cover some of the elements of testing, what types of tests we do, some of the therapeutic options. This is an area that I always say speech-language pathologists and audiologists work together the most in two areas, oral rehab and CAPD. When I was an administrator at a hospital in Texas, we did APD testing. We would then, for those adults or children who had central auditory processing issues, we would then refer them to the speech-language pathology department for different remediation techniques. So this is something that you as SLPs will be doing, okay? So auditory processing refers to the efficiency and effectiveness by which the central nervous system utilizes auditory information. I always say it's what the brain does with the auditory input, or with what the brain does with what we hear. Okay, it involves both serial and parallel processing, meaning one station, one auditory structure after the next, but also things that happen in parallel. And the one area, and there's some controversy surrounding central auditory processing disorder as to whether it's purely an auditory disorder, because issues with language, attention, executive control or function, developmental issues, all of those can affect performance on an auditory-based task. And so as audiologists, when we do CAPD testing, we like to rule out those things: language issues, attentional issues, developmental issues. We like to rule those out before we test them, because all of those can affect our results. Here's a review of the central auditory pathway. So here you have the auditory nerve, the cochlear nucleus, which is the first station. In the middle, you have the superior olivary complex. Okay, this is, if you remember, a structure that's heavily involved in processing binaural information, processing information from both ears. And so this is where the brain kind of takes information from both sides and does a lot of extracting of information, like time differences, localization, stuff like that. Okay, so the SOC is right here. Then you have the lateral lemniscus, the medial geniculate body, which is at the level of the thalamus. We know what that does. And then we have it running up here to the auditory cortex, which is on the superior temporal gyrus, right? Brodmann's area 41. Okay, so just a little review. There are tests that specifically assess SOC function, auditory cortex, and so forth. So here are some areas of auditory processing testing and skills. So we have sound localization. We have auditory discrimination, auditory pattern recognition, so being able to recognize different auditory patterns. So one test that they use is, they call it a frequency pattern test, and they'll present 3 tones. 2 of them will be the same and 1 will be different. So they usually use like an 880 hertz and then 1,000 hertz, so, or 1,100 hertz. So it might be 880 and 1,000 or 1,100, and it'll be low, low, and high. And so they'll have to recognize where low, high, low. So they'll have to recognize those patterns. Auditory figure ground is essentially listening in competing background noise. And then temporal aspects of audition. There's been a lot of study of the effects of what we call temporal processing on reading and language and different aspects of what your profession assesses. And they found a fair amount of evidence to suggest that the slower the temporal processing that kids have, so poor temporal processing, can lead to deficits in speech perception, reading, and auditory abilities. Okay? So you could take a look at that first bullet point. So auditory processing disorder refers to difficulties in the perceptual processing of auditory information in the central nervous system. Okay, and is associated with a number of behavioral manifestations and a variety of symptoms, some of which are pretty subtle. So here we're going to go over who are the people that should be referred. Now, most normative data for APD testing starts at about 7 years of age. I think this is really important, and it might be mentioned later, but I want to mention it now in case it's not. Some people will make the claim that you can test children younger than 7, which is true, but there is limited normative data. So typically, I would recommend that until they hit 7, there's just not enough information to compare to. So some of the behaviors that are common are similar to those who have hearing loss. So difficulty comprehending speech and noise, decreased attention to auditory information. A lot of times children with hearing loss stop paying attention. They're not aware of sounds. They quit. They kind of give up. So they seem like they're not paying attention. Same thing with APD. Inconsistent or inappropriate responses to auditory information. Difficulty comprehending and following rapid speech. Giving directions. This is one of the most common complaints that I would get from parents was children, the child was had a lot of difficulty following multiple step directions. Okay? Now, my kids don't have APD. They have difficulty following multiple step directions, but that is a common complaint. Regularly ask for information or directions to be repeated. Lack of ability to detect and produce changes in the prosody of their speech or the flow. Poor phonological and phonemic awareness. Poor auditory discrimination skills for speech sounds, phonetic issues. Difficulty localizing sound. Weaknesses in speech and language or psychoeducational tests with an emphasis on auditory comprehension or anything auditory related. Okay, and then difficulty with language. The team is composed of the audiologist, speech language pathologist, sometimes the teacher, the deaf or hard of hearing teacher, depending if they're getting any kind of services for once there is a diagnosis of APD. So if they're using an FM system or what have you, they might be involved. Okay. Now, again, so here it is. It talks about 7. Some tests you can go as low as 5 years of age. I don't recommend it. The tests some of the tasks are pretty complex. So at 5, I think it's difficult for them to understand the task. But I really haven't tested anybody younger than 7. And the auditory cognitive abilities may be used to link the reliability and validity measures to specific weaknesses and auditory skills that they may be experiencing. Now, what we're going to talk about is the behavioral testing, not the electrophysiologic testing. So there's 2 components. The behavioral test, here are some of the tests that we do. Auditory discrimination, auditory temporal processing and pattern test. I just mentioned one of those. Dichotic speech test. So some of the tests that we do, we will play dichotic, meaning hearing 2 different words or sounds at the same time, one that are different in each ear. So a dichotic test might be in the right ear you hear dog, in the left ear you hear cat, That's not a good one. You hear dog and then boat in the left ear, dog in the right ear, boat in the left ear. And then the person has to either repeat both, so integrate it, or pay attention to only one or the other, selective attention. So that's a dichotic test. And it takes both sides of the brain. And then, of course, the structure that connects both sides is the corpus callosum. And so there are some things that if you find there's a corpus callosum deficit, we'll talk about a little bit later, you can do some tasks to stimulate both sides. Monaural low redundancy speech test, essentially that's filtered speech. So you take a regular speech signal, you low pass filter it to remove all the high frequency energy, and it takes away a lot of the redundancy or the ease with which people can understand it. And then there's binaural interaction tests, which test both sides of the brain and test the corpus callosum. So the auditory discrimination test, discrimination of speech sounds, involving the ability to identify the frequency, intensity, and duration. This test here, the gap detection test, are very common. That is a test of temporal resolution. So, you hear a noise, psh, psh, and you hear these gaps will vary in duration. Sometimes they're 2 milliseconds, sometimes they're 20 milliseconds. And we test their ability to resolve that break in the sound. Okay, that's called a gap detection test. And then we talked about the duration. We talked about frequency pattern, but there's also a duration pattern test where the sounds will be short, short, long. So maybe two of the sounds will be 250 milliseconds. One will be 500 milliseconds. So it'll be short, long, short, short, long, long, like it just depends. And so the subject, the patient has to detect the duration of the sounds. Dichotic speech test. Now these are the ones that I mentioned where you hear two different words at the same time, one in each ear. And so when you do that, if you hear both words, you need to then, if you have to repeat both back, right? You need the right and the left hemisphere, the left hemisphere being more to produce those sounds that you heard, okay? And so there's something called a right ear advantage. So the auditory system works very strongly on contralateral pathways. So the information going from the right ear goes directly to the left hemisphere, and it's easy to process because that's the language processing center. Or side. When the sound goes to the left ear, it goes to the right side, and then to produce it verbally, it needs to cross over to the left hemisphere through the corpus callosum. Okay, so a right ear advantage is due to that. Left hemisphere dominance for producing speech and language. Okay, so it goes into the right ear, goes straight to the left because it's contralateral, so it's easy to produce. When it goes in the left, it goes to the right hemisphere, and then it has to cross over the corpus callosum to be produced on the left side. Okay, and that's present up to about 11, 12 years of age. Okay, monaural low redundancy speech. There's different ways to do it. The low pass filtered is one of the common ones. You can also present speech and noise, or time compressed speech. So instead of the sentence being 3 seconds long, it is now, if it's 50% time compressed, it's now 1.5 seconds long. So it reduces the redundancy in the speech signal. It makes it more difficult. Okay, that is what I'm going to do for this. We'll start here on the second video.